Welcome back to the show. I'm your host, Ankur Patel, and today I have with me Tate Ringer, who is the Chief Strategy Officer for a very large mental care institution in Texas. Welcome to the show, Tate.
Hey, Anchor, thanks for having me.
Of course, it's our pleasure. Just for the benefit of our audience, would love to hear your story, particularly how you got to the particular role that you're in at today.
It's so funny how we get places. That's one of my favorite questions to ask people. It's a very long and windy road. I've started out as a financial analyst and with a liberal arts degree. So it's proof that you can end up anywhere in any way, especially now because now we have so many opportunities to learn whatever skill set we need outside of whatever our professional degrees or training were, and in particular with AI. I got here through, I swore I'd never go back into nonprofit or into healthcare or and I did both of those and added governmental to it. So never say never. I guess after being in startups for about 5 years, I got pulled back in.
That's an incredible background. I think it shows that you could go and start in one area and then land up in entirely something else. I think especially now where you do have a lot of great resources to go and upskill and train, and I think that cross pollination of different disciplines is actually very valuable. So I think people forget that sometimes that horizontal approach is really great to be really successful. Well, I guess switching gears here, when how should we think about the chief strategy role that you occupy? What are some areas that you primarily help out with at the institution that you're at?
It's interesting. It was a specially designed role by our CEO. I joined 5 years ago, and the goal was to not only do business development, create more access to care for our community, but also to break down silos internally and externally. Typically, a governmental agency is thought of in one certain way, and we have really broken the mold with that in our thinking with innovation in mind, thinking with diversity in mind, and part of my role has actually been helping be that translator between operations and IT. Because of my startup experience and serving the client services role on a startup data company, it's really been a good fit to bring in some ideas and some thinking that weren't part of the institutional history.
I know one of the top issues that we've talked about in the past has been staff burnout, right? Particularly in the healthcare space, but perhaps more broadly, right? I think it's very common across professions, but I think that is a very hot topic item. Curious how you would define burnout, because I think one of the things that I often find is when you think about burnout, it's very hard to know whether you're experiencing that or you're deep into that, or it's like the signs are very hard sometimes, at least for an outsider, to pick up on.
That's a really good question. There are actual assessment tools that officially help define burnout, especially for doctors. They're the highest paid staff in the healthcare industry, and so they want to protect them and keep the ones they're especially good. New England Journal of Medicine said in 2022, 52% of nurses and 20% of docs said they were going to leave their clinical practice. Now that's in addition to the about 20% of baby boomers that are in process of retiring. So think of those implications of what staff are we going to have available to care for people. So if you're not helping, even after COVID, the remnants of COVID have just exacerbated. It's not the great resignation anymore, but at the same time, it is very clear that CDC, other institutions are documenting the level of burnout in the healthcare industry in particular.
And what are some of those signs before it leads to the point where there is this indication of leaving their practice, right? Are there things that they could look for, or the institution that's responsible for them could look for to go and preemptively intervene when the time's necessary?
It depends on if the institution's listening. The institution has a culture of feedback and which also feed into when we talk about implementing technology too. If they have a culture of acceptance, of including, of providing agency to the staff, then they're going to be able to see those signs. But if there's a gap between how the administration communicates with the clinical team and all the administration does is drive them to meet their benchmarks and drive them to meet the numbers, then they're going to miss the signs even if they're there. But complaints, not willingness to, some silent signals of just not being as forthcoming. Also, not getting enough sleep. You hear people talking about enough sleep, or they want to take off, but they don't feel like they can take off and use the PTO that they're given. Mm-hmm. So, and certainly some of the contributors to that are administrative burden and overload, which is going to feed into how technology is helping that or hindering that, and adequate pay. I mean, I think the reality is if you're saving other people's lives but it's killing you, then there's a problem there, and that's what our healthcare workers are saying.
I think that's such a front and center issue, which is you don't have enough providers and professionals, clinicians that are providing this care to serve the healthcare needs that we have as a country. And I think that the ones that we do have are overworked. And the natural question is, how do we kind of go and help them reduce that workload, right? So that they don't burn out, and that if they are experiencing burnout, we're able to intervene. And I think that technology does have a major role, both in terms of identifying those signs of burnout, but then also try to remove the causes of the burnout, right? I mean, you mentioned one thing, which is like administrative tasks, right? And I'm often shocked as an outsider listening to some of the problems in healthcare that a lot of the time that the providers spend is on documentation and administrative work, even in the course of seeing patients, right? Like if you spend 30 minutes with the patient, half of that time might be documenting the conditions and whatnot. And you have to do that, of course, for future for your future self, but then also you need to do that because the insurance providers require you to do that as well. But just where do you see the opportunities today around reducing some of the burden for some of these clinicians so that they have a better time with the rest of their workload?
So if we think back to the history of, EHRs were developed in order to make health information portable, to be shared among, not only for billing purposes, there was also, there was a monetary driver, but, the requirement to have documents that can be shared among providers is fairly recent. It was about 15 years in the making, but it's only now in 2024 when there's actual penalties for institutions not having that. So that driver is something good for the patient. We're getting better information, we're having better documentation, we have transparency for the healthcare provider, but at the same time, that's also made for more complicated systems. And the more our healthcare technology, the actual solutions that we have get more stronger and more complicated, that also means the billing and the documentation and the collaboration are that much more complicated. So now you've got systems that are legacy systems. What Epic was developed, one of the largest EHRs in the world, was started in 1979, first put into a hospital in 1998. Here we are 2024 and still 43% of clinicians think that their EHRs have a negative impact on their efficiency and workload. So there's a gap there, to say the least.
Yeah, absolutely. And it's surprising to hear that because you think electronic health records, what a great phenomenon, because now you don't have as much paper, it's all electronically captured, you're able to use that information from one provider to the other, so there's maybe more collaboration among your healthcare team. But when you look at this from the perspective of the clinicians, they're actually spending more time doing things that's making their lives less efficient. And so we have now this documentation requirement, but it's maybe even hurting the quality of care that we get. So and I get that, like Epic's been around a long time. There are things that perhaps are not as efficient. Are there things that come to mind, maybe even some stories around, where does that inefficiency come from, right? Because if you can imagine logging information on patients that come in and their conditions and tracking that, we do, of course, like in the modern world, in modern software, have good ways of documenting information, and that information is read in and categorized and classified and actioned on by things like artificial intelligence. So what about that process today is broken that's causing this reaction from the clinicians?
So I think there's a good analogy when you think about when cell phones first came available. Here in the States, it took us a long time to widely adopt a full network. But you look at developing countries, and they actually got to full adoption much sooner than us and other developed nations did, because they had no infrastructure. So all they did was build cell towers, and all that system was built together. And now we're looking at layers upon layers of new great technology that is useful, that we need, but it's layered into an existing system that maybe wasn't built for that. Collaboration's the best example. I've been working with a private physician who is looking for an EHR to start a new practice, but his practice is very holistic, lifestyle medicine oriented, and he wants the dietary coach and the fitness coach and the general practitioner and the nutritionist all to be able to see the same information and be able to collaborate real time. There's not systems out there that are doing that smoothly. So everything, so he's got to pick an EHR, he's got to pick a collaboration software, he's got to load in something like something else in order to make sure the billing's talking. So, and they're private pay, they're not private insurance, maybe.
Yep.
So you've got layers upon layers of great technology that are just making the systems more complicated, in addition to your regulatory requirements. HIPAA keeps adding. We just got another one this year, new changes to HIPAA privacy. You've got the OCR and OCD requirements. So all of those are just making it more complicated. Very few of them are actually making it easier in the way that, say, multimodal's doing. And some of the others that they're finally starting to embed some of that, but even that's complicated to integrate.
Yeah, I completely understand that. It feels like on one hand, the regulatory environment's getting more intense, and then you have a lot of legacy systems, which maybe were really great at some point in time, but then they've gotten layered on top of each other. So you have a lot of like older legacy software that's been built up over time, and then you're also trying to introduce more modern experiences built on top, and that layering of old and new together is making things more complex, right? And I think that is the reality. Like, I think when there's a modern technology like machine learning, even like what we do at Multimodal is like we're trying to take this new technology and we're trying to apply it. You almost can't gut and replace a lot of the existing software that's there. You do have to take that as a given, because it's so hard to gut and replace that. It's almost like a non-starter. So then you're trying to figure out what is the most seamless interaction that you could introduce between the legacy software that has to be there and then newer software that could develop better experiences on top. And I think that will be one of the major challenges that I think startup founders and operators will have, as well as, of course, the existing corporations that are trying to innovate, right? It's like, how do you innovate when you have a lot of legacy software that's in the mix that, again, is serving a critical function, but may not quite be ready to go and deliver more like a more efficient, better user experience, right? And I think that mishmash between old and new, I think, is going to be a major challenge for many to navigate in the coming years.
Yeah, I think there's one example that comes to mind. I know an organization that was looking to embed some risk stratification a new algorithm that had some machine learning and some AI tools embedded into it. And the challenge with this system is they implemented it and built it outside of their existing system. Then when they went to use it, they found that the workflows didn't work at all. So the physicians were not getting the alerts when there was a risk identified. Well, now that's actually put that organization in greater jeopardy from a lawsuit or a compliance standpoint, because then someone can come back and say, well, you had this tool, the information was available to you, why didn't you use it? But then they found there was a gap in it actually getting to the end user. And you're talking about the physician that maybe has 15, 20 minutes tops with the patient and is not going to have time to go search through, step by step to go find that alert to make sure it's there.
Yeah, I think that's right. I think
it's a professional having to go search.
Yeah, you have a limited amount of time. You won't be able to resolve it all. But then if someone really opened up like a lawsuit or some sort of inquiry, what happens is that you find that there is maybe notifications or alerts, but it's almost like playing a Monday morning quarterback where you're replaying the tape saying it should have been done this way or that, but
right.
Realistically in real time it would have been very difficult to catch, right? So I think trying to go and figure out what should the physician or what should the clinician see in real time because it's urgent, it's important, and then which things should they ignore, right? Because it's not as relevant. I think going and managing through some of that is an area where I think software, if they deliver the right user experience, could really help with. Because I'm sure clinicians have a difficult time with the healthcare system and with all the requirements that they have. I will say as a patient, of course, the healthcare system, you also find things frustrating where you're entering. It feels like the same information every single time you go back to the practice.
Yes.
And it's near impossible to have one practice send information to another practice. And so you're almost having to go through the same sort of battery of tests or questions in order to get to like even just the starting ground. With another specialist. So I think there's a lot more that could be done. I think the challenge, of course, is how do you take a lot of very complex organizations with a lot of complex software and then modernize it, right? And I think one of the areas that we're seeing maybe some degree of excitement is on this transcription, right? Which is like having real-time transcription of notes during patient clinician visits. So how big of an impact is that in your mind? Is it really as exciting as people claim it to be, or are there things that perhaps we should be a little bit more cautious about?
I think it's huge. It's one of the easiest ways that you can make a difference for staff and patient. I mean, you talked about the patient experience. I mean, how many portals do you have for each one of your doctors? I mean, even if you're a healthy person and you have a general practitioner and you're a woman, you also have a gynecologist, or maybe you go to the dermatologist. I've got 3 different portals already, and none of those share information. So yeah, I think there is a huge opportunity for global integration, but as long as we have different insurance in different states and qualifications, that's going to make it tough. But on the transcription side, for the patient and the physician, that means as a physician, I mean, most of us are used to going to a doctor and then they're looking, or the nurse, and they're looking at their keyboard and typing in real time. Well, that's best practices, right? Because this way I make sure the information is accurate. I don't have to rely on my memory. But as much as we are a technology society, we still need this face-to-face, even if it's on the screen. So one, I'm not seeing the doctor or the physician's not seeing when I answer the question about, how am I sleeping? And I kind of sit there and think and kind of wince, but I tell him I'm sleeping fine. But he misses, or she misses, my facial interactions. Then that's a huge miss, because someone else might say, well, wait a minute, are you really sleeping fine? And then all of a sudden I answer differently because someone paid attention to what my body language is showing. And we're in mental health, so body language is everything. We can't do all of our visits virtually. But to your question about the transcription, so not only does that mean you can have more personal experience with your physician, better care, but that's also huge. I actually did the research for the agency for our company on, I must have looked at, I don't know how many different companies that were that offered some version of this service, either ambient listening or recording, and then real-time note transcription, variations of that. At minimum, all of them say they'll save about 5 hours a week on the low end for a clinician's time. And that depends on, in mental health care, we've got to give more clinical notes, and the clinicians versus the physicians have different types of notes, and they can distinguish between the two. So not only does it save them time, huge to the burnout and the administrative overload. They're not in the business to fill out forms. They get in the business to help people. So that's not helping feed their passion or feed their soul. So you're also literally saving them time, getting them to do more of the work that they want to do, as long as you don't tack on more work on top of it. So that's something to heed for companies. But then also the notes are more compliant. They can look and see, they're actually capturing the individual's notes versus copying and pasting what's typically said. They can also capture when they use a word for transportation versus, I'm trying to think of medication management versus giving pills. Some of those technical terms that the insurance companies will key in on and say that the service is not does not qualify. They'll align the position, say it's a licensed clinical social worker, with the type of services that person should be providing, and make sure those are aligned. So that's huge on a compliance standpoint too. So and more EHRs are embedding those systems and having agreements with those companies to bring them in. So each time, each individual organization is not having to do a new implementation themselves.
Yeah, it becomes part of the offering from some of these major players like Epic, right? And so it's easy to integrate and introduce. I think that's really, really important to have. The way I think about it is like in software, how Salesforce is a CRM, but if you want meeting notes, you have things like Gong, and Gong sits on top of Salesforce or integrates with Salesforce, and so you get meeting notes and transcriptions, but it's also being now linked back to your CRM, so it's capturing all the activity via email, all the meeting notes and the opportunities board, so it just syncs up very well and nicely, so it's not introducing more friction. It's actually making your life easier, right? And I think that is a beautiful application that really helps physicians really enjoy more of what they do. It's akin to like if you were in a meeting and you had to go and focus on the meeting and take meeting notes, it would just be an impossible task, right? So I think having software do that is really great. What about in mental health? I think there's been this huge interest in, can you help patients or would-be patients understand a bit more about what they're going through, maybe have suggestions, have some coaching in between or outside of visits with physicians, leveraging maybe information about the patient, and then leveraging information that the physicians or clinicians really want to go and provide. So it becomes more of a interactive like chat experience. That's become a really hot topic, and I'm curious what your take is around A, the viability of that, just given how important it is to get the proper medical advice, but then B, whether you've seen any of that transpire with some of the work that you do.
We don't typically. There are some compliance things for us to get through to do that, but we have ongoing discussions and are still investigating the ability to do that. I think it's huge because, especially in mental health, some patients don't know what's a mental health challenge and what's just every day, this is life, and this is the normal that I've gotten used to. Is it appropriate for me to need to sleep 3 hours a day? Here are some tools, and we've done this old school through our website, but here are some tools that you can use, and if these aren't enough to alleviate whatever symptoms you're having, then maybe that's a good reason for you to reach out to a mental health care provider. But having that embedded and having engagement through, those right now need to go through a portal, and in the demographics that we serve, that's not widely adopted, so that's why we've put that on the back burner. But I think for a demographic that is online and cued in to those platforms, it's a really great tool to help. And it's also, too, if you think about teenagers, when we were teenagers, we didn't want to tell our parents. I don't care what generation you are, you don't want to talk to your parents. So if you have a safe place where you can go and engage with some confident information, and then the that tells you, oh, this is what I need to do. Maybe I do need to talk to my parents about this. Or here's something my friend's doing. This is a sign that maybe they're having suicide, so I need to reach out. Now, right now you're seeing a lot of that on social media. So you see a lot of influencers, and we utilize that to help share that information. But to have it embedded with the clinical services, I think, is ideal.
Yeah, yeah. I mean, I tend to agree. Looking from the outside in, because and I realize it's a sensitive issue. There's a lot of regulatory and compliance work that has to get done. But absent the healthcare system providing these services, you're going to have individuals that DIY, right? They're going to go through ChatGPT, or they're going to go through social, they're going to do Google searches. And so it's almost like, well, the best solution would be, I know it's difficult to build, but for the healthcare system to have better, more informed outlets. And then you're also able to pair software with actual physicians, right? That can go in and intervene.
Yes.
And so they could take you could offload some of the work to software and AI, but then you're also able to provide that human interaction and intervene when you need to. And it brings the cost of the care down too, potentially, which is you're able to focus on the individuals that need the help first and foremost, that need it most, and then you're able to kind of at least give the rest at least some orientation around how to approach or think through this. So I do think that it's a, and if we get this right, I think it could be a huge boon to the system, both to the practices, but then also to the patients as well. Switching gears here a little bit.
I'm keeping an eye on a couple of startups that really have some interesting platforms. It's not in our roadmap right now. We've got some other things that are key priorities, but it's definitely something that I'm seeing develop live, and I hope we get to at some point.
That's great. That's amazing. I love how much of an open space this is right now for companies to go and build and deliver beautiful experiences. What about the billing side, right? So there's, of course, there's the patient care and making sure that's right. But the other big hurdle is for practices to really work with the insurance providers to make sure that the payouts happen, that the billing is appropriate. And it feels like there's a lot of administrative costs in the system around that activity. And it seems to get worse in some ways over time because of the complexity around that. So are there ways that you're seeing software helping out or potentially helping out with what you're seeing coming down the pipe? What does that look like?
Well, I think the insurance companies have been way ahead of the game. They've been utilizing systems for much longer than the healthcare operators have been to not pay what they don't think they should have to pay. Mm-hmm. And I'm not here to bash insurance companies, so I don't mean it that way, but let's talk about they're just being more efficient. They have faster ways to be able to check to see if a code matches up with the service provider. So I think the operators are continually trying to keep up with that industry. And some of the things like we just talked about, like ambient listening and some of the note dictations, actually have all of that embedded so that you can make sure that it's going to be coded as effectively as possible. Also, for the revenue cycle management companies, most of us outsource to somebody and don't have it internal. Most of them are now using those tools to be able to not only better serve their clients, but have fewer denials. So that means you have to work less on the back end to get something recoded and reprocessed, which ultimately reduces cost. So there's no question that especially for those companies where there's an easy ROI, that investment is a no-brainer. I think it's other ROI that's harder to see on the provider side, that's harder to necessarily quantify.
I think that's right. I think there's maybe there are different paces of like technical adoption, right? And I think the insurance companies have been very good at adopting it because they want to make sure that they're doing the appropriate payouts, right? But it's now a question of how do you make that easier for the entire system? Because ultimately that does affect patient cost and healthcare costs, right? At the end of the day, and so make sure that's appropriate is really important. I mean, the other area that we see a lot of pain is around patients not knowing what how much their insurance covers, or if certain providers are in network or out of network, right, or they've hit their deductible. And right now the typical way to go through this is you go through a phone call or chat support or email submission. And so part of that is that information should be more readily available, so you could go and validate who you are as a patient, what insurance carrier you have, what the ID numbers, group ID numbers, whatever it might be, and then just get a good response from software, because the software is plugged into all of the data that's necessary to go and offer up that response without even having to go and get a human operator, because that's going to slow things down. It's going to add more expense. And I'm curious if you've seen any activity on that front, because it feels like that is a huge area of opportunity that hasn't quite been tapped yet from at least someone on the outside looking in.
Yeah, absolutely. It's and in fact, that's an interesting way that the companies are aligning with the insurance companies to join in that force, because that means they're finding the lower cost provider, which is especially for those who are self-insured. If you provide these concierge services that have AI capabilities that can automatically analyze your contract and can automatically determine that information from the providers, now all of a sudden you've found a win-win for everybody, because everybody wants to pay less. That means I pay less on my copay. That means my company pays less on the total payout. And that means it also is going to help market influences to get people to more appropriately price their services. So
Yeah, I think
it feeds the whole system in a very positive way. And luckily, now the major insurance carriers are embedding that in some of their offerings.
That's great. That's incredible to hear that that's something that's coming down the pipe. And that's, I agree with you. I think it's a huge room to go and reduce expense, right? To reduce costs in the system.
You know, and I think
as we were
one thought there, I remember we had a concierge service at one of my companies that I ran in the 2010s, and they eventually went out of business because the manpower was too high for, but now you're seeing that come in with technology, and it's a no-brainer.
Yeah. That's incredible.
It's a great concept, period. But now I'm like, why did this not work? This was such a great idea. Well, this is why.
As we think about new technology, these transcription, chatbot-like experiences, ways to go and reduce some of the pain in billing management, what kind of proper training or change management do we need to make sure that there is appropriate adoption of the new technology and that the end users are satisfied, right? Because part of it is you can't just introduce technology, hope that it gets adopted, hope that people find value from it. I think there is a change management piece, and I'm curious what you're seeing with the work that you do.
That is huge. That is a large part of what my role is. It's also a large part of what I advise other companies and colleagues that they need to make sure about, is that there's change management. It begins before you've even started. You bring in your operation team to get an understanding of how they think the system's going to work for them. So you get that feedback during the RFP process. As you're doing demos. You include some of the end users, not just the executives, but the end users who are going to use it day in, day out. So all along that process, they need to be involved. And so that's the beginning of the change management. They've actually been a part of the decision-making process, which makes the change management much easier down the road. And I think the other piece about adoption is it needs to be easy to adopt. Yep. So there may be more time on the front end to plan, to change workflows, but that should mean that adoption takes 30 to 60 days, and that the companies can document. Our training time was 1 day a person. Our training time was not 2 weeks. So that needs to that to me is the baseline of what we should expect from technology now, is documented training time, documented onboarding time, and what's the utilization post, not only first week, but 3 months out, so that we revisit. And once it's done, is it still working? We just did a survey with our FQHC, our county hospital, where we share about 40% of our patients. And we double checked that the work we did a year ago to make sure that our care quality system was communicating between the two was actually still working, and we found a gap. Had we not asked, so the change management system is all along the whole system. It's not change management when you're doing the implementation.
It's incredible to hear, because I think what you're saying is that the people that will be involved on the change management side, they need to be involved very early on in the decision-making process, right? So you get buy-in up front. And then I think you're right, tracking the value that's been created from the adoption of this technology has to be part of the mix. Otherwise, you really don't know if it's working well or not. And I think that is critical to making sure that you get feedback on the investments that you make and you learn from them. I'm sure there will be some investments and some endeavors that don't pan out, others that do, but learning from which ones do pan out and why will inform how you kind of go and work through the next set, right? And I think, as you look at, basically as some of the audience here looks at building startups and operating startups, same thing, you want to introduce software that is heavily used, and if it's not being used and delivering on the value that was initially quote unquote promised, that's going to be a cause of dissatisfaction and churn, right? So building with the user need in mind, make sure that they're getting value is really critical for both parties to be satisfied long term.
Yeah, I think that's critical too. If you don't have a successful implementation, be honest about it. Get feedback on what didn't work before you try to implement the next one, so that people understand that, okay, here's what we didn't do well that we want to do it better. Help us do that. And also to build in leadership capacity that says, that's the operation, the clinical leadership, to say, you know what, this may not have gone well, we may not like this part of the system, but that doesn't mean we should give up on technology, because here's what we're trying to get. What's the end benefit for them? Why should they be invested? Why should they spend an extra 30 minutes every week giving feedback on user acceptance testing? Here's why. This is why in long term, we think this will be a value, even if this didn't go well the first time. And then also getting feedback from others in the same space, to have them get direct feedback to say, this is why this is valuable, this is why it was worthwhile, here's what we did, here's what you should learn from us. That can be a huge part of change management that people don't think about, to actually bring in other users from other spaces to get real world feedback. And that can help break down some of that resistance.
I think that's an incredible point. I think the lessons in one department, one area, are really valuable to the rest of the organization. And I think that is the right frame, which is when you think about new technology, you have to be open to experimentation, taking some level of risk, right? But again, learning that each bet or investment that you make is going to yield outcomes, and that you could learn from good and bad, right? And being able to go and kind of run through those investments and try to go and get better value with every single new investment that you make requires kind of going through that methodical process, right? And that's how you get more buy-in. It also reduces the fear or the anxiety that some teams or individuals may have around new technology, where it's like, if you can go and see that the technology is really beneficial to the organization and to the people, both the employees and then of course the end users, that's going to kind of go and power the anxiety that some may have around some of the newer technologies out there like AI, right? So I think that's a huge piece of getting good organizational adoption of new technology like this.
Absolutely. And it does start with the leadership, that they listen, that they also have an open mind, and that they're honest about what their teams are actually experiencing.
Well, one final question to maybe close out here. What future trends in technology are you foreseeing that could really impact staff experience and burnout reduction in healthcare?
Oh gosh, um, that's hard to define. That's hard to narrow down. I mean, some I'll have to say, the gadgets are pretty interesting. I mean, think about that I'm going to be able to look at my phone and search with my eyes. I don't have to use my fingers anymore. I mean, think about that from an accessibility standpoint. Um, the other piece is that from a staff burnout standpoint, I really look at human resource information systems, HRS systems. We're talking about healthcare, but healthcare is also a people-driven company, industry. And so if I think about on my, if my HRIS can engage people like you were talking about engaging people in mental health care, if we can engage our employees, I don't have to promote a survey. I can get real-time feedback, or I can have discussions analyzed and find trends of what my teams are talking about. I mean, that's a pretty huge. I mean, if I can see trends on when people are thinking about retirement, we've got 20% of our workforce that's going to retire in the next 5 years. That information that's coming, that's being analyzed at a level that humans can't do, that's really a game changer. And we're looking at a number of those things that are replacing or augmenting surveys, that are replacing, giving people a real way to give transparent feedback that they feel safe giving. And also having the tools to respond to that feedback without us having to do it as humans too. So that's also going to take off a burden on the administrative side, so our managers are less burned out. I mean, they're the ones that we're also, our line level managers are the ones that are really have they're salaried employees, not hourly, and they're the ones that are taking on more of the employee challenges, more of the training time. If we can reduce that for them, that's going to be huge. And training in and of itself, there's so much that's regulated in healthcare that if we can bring in neuroscience and pair that with AI capabilities, that's also a game changer. So those are very interesting. There's a number of companies that are looking at that, and we're actually partnering with one institution here in Dallas.
That's incredible, Tate. Well, really appreciate your time here today. Very excited to see what happens in this broader space. To have you back on as a guest in a year or two from now to see what truly transpired and how the space has shifted over that period. But thanks for being on the show. It was an incredible conversation. Yeah.
All right. Ankur, thanks for having me. I really appreciate the work you're doing, and appreciate that you're really listening to the feedback of what's happening to people in the industry, and that's driving your creation. I'm not a coder and I'm not a techie, but I just play one on TV, I guess.
You do a fine job of that. I really appreciate it.
Thank you, Ankur.